That number on the blood pressure cuff, it could be wrong by 10, 15, or even 20 points. A single inaccurate reading can be the difference between a clean bill of health and a lifelong, unnecessary prescription. Welcome to Levitas. Today, we're exposing the 9 worst, and most common, mistakes that hijack your blood pressure readings, both at home and in the doctor's office. I have a question for you, and I want you to be honest. When was the last time a doctor or a nurse took your blood pressure? Let me know in the comments, and as we go through this, please take a second to hit that like button. It's a huge help for the channel. First mistake. Alright, let's get right into it with the first and most obvious mistake: putting the blood pressure cuff over your clothing. We've all seen it or had it done to us. The nurse is in a hurry, you're in a hurry, and they just slide that cuff right over your sleeve. Now, to be clinically accurate, I have to tell you that some recent research, like a 2022 study, suggested that a very thin sleeve, we're talking less than 2 millimeters, might not make a statistically significant difference. But here's the truth, that is just bad practice. First, how do you know how thick your sleeve is? And second, anything thicker, like a normal shirt or especially a sweater, will absolutely give you a falsely high reading. But that's not even the real catastrophe. The most dangerous cuff mistake is using the wrong size. This is far more common than you'd think, especially for people with larger or more muscular arms. A major study highlighted by the American Heart Association in 2022 delivered a shocking number. They found that using a regular-sized cuff on an arm that required an extra-large cuff falsely inflated the systolic pressure, that top number, by an average of nearly 20 points. Let me repeat that. 20 points. That is the difference between having normal blood pressure and being diagnosed with stage 2 hypertension. It's the difference between keep up the good work and here's a prescription you might have to take for the rest of your life. This is a massive, massive error that leads directly to overdiagnosis and unnecessary medication. You have every right to ask, is this the correct cuff size for my arm? Second mistake. Okay, let's move on to our next set of mistakes, which I call the positioning pitfalls. Your entire posture during a reading is non-negotiable for accuracy. The first one? Crossed legs. It's such a common, comfortable habit. But in a clinical setting, it's a disaster. A 2007 study in the Journal of Clinical Nursing, which was backed up by similar studies in 1999, found that just crossing your legs at the knee can temporarily increase your systolic blood pressure by 8 to 10 points. Why? It's simple physics. You're squeezing the blood vessels in your legs, which increases resistance, and you're pushing the volume of blood up from your legs into the rest of your circulation. The heart has to push harder. Now, interestingly, the research shows crossing at the ankles doesn't seem to have the same effect, but the official guideline is clear: both feet, flat on the floor. The next positioning mistake is the slouch. If you are sitting on an exam table and your back is dangling in the air, your core muscles are tensed just to keep you upright. That muscular effort, even if it's small, can raise your reading. Your back must be supported by a chair. And finally, the dangling arm. Your arm, and the cuff itself, must be supported, and it must be at the level of your heart. If your arm is hanging down at your side, gravity will cause the blood to pool, and your reading will be artificially high. If you're anxiously holding your arm up in the air, the reading might be artificially low. The gold standard is a supported arm, with the cuff at heart level. Mistake number 3. The next 2 issues are subtle. They're the internal saboteurs, and they are incredibly common. First, a full bladder. Think about it. You've been in the waiting room, you have to go, but they finally call your name. You think, oh, I'll just hold it. It'll be fast. That is a huge mistake. A classic study in the journal Hypertension looked at this exact scenario. They found that when healthy volunteers had a pronounced urge to urinate, their blood pressure jumped from an average of 125 and 74, all the way up to 140 and 84. That is a 15-point systolic jump. A full bladder activates your sympathetic nervous system, your fight or flight response, and your body physically tenses, constricting blood vessels. Always empty your bladder before a measurement. The second internal saboteur? Talking. Or even active listening. The nurse is trying to be friendly, asking about your weekend, and you're politely answering. A 1999 study from Oxford academic had a powerful finding. When hypertensive patients were talking, their blood pressure sharply increased from an average of 142 and 97 to 159 and 111. That is a massive spike. The period of measurement, from the moment the cuff starts to inflate to the moment it's done, must be silent. No talking, no aha, no yep. Just quiet, calm breathing. Mistake number 4. Now we need to talk about what happens before the cuff even goes on. These are the preparation problems. The biggest one is the rush job. They call your name, you walk 30 feet down the hall, you hop onto the scale, you hop off, you sit on the table, and the cuff immediately inflates. This is wrong. And it guarantees an inaccurate reading. All major clinical guidelines, including from the American Heart Association, are crystal clear. You need 5 minutes of quiet rest before the first measurement. This is to allow your body to reset to a true resting state after the activity of, well, just walking down the hall. This also ties into the next issue, recent activity or substance use. If you just ran up the stairs to the clinic, had a smoke in the car, or just finished a large coffee in the waiting room, your reading is going to be high. And it's not your real blood pressure. Research from 2018 in the Journal of Hypertension confirms what we've known for a while. The blood pressure raising effect of caffeine can last for 30 minutes or more. The rule is simple: no exercise, no caffeine, and no stimulants for at least 30 minutes before your measurement. Mistake number 5. Our final category covers 2 big picture issues that can completely change your health case story. First, ignoring the white coat effect. This is the famous phenomenon where your blood pressure is high in a clinical setting, but completely normal when you're at home. It's not just being nervous, and it's not your fault. It's a real, measurable physiological response to a stressful environment. And it is wildly common. Some studies, like one from 1999, found that over 21%, that's more than 1 in 5 people, who are diagnosed with hypertension only have it in the doctor's office. Now, more recent 2024 analyses do confirm that this isn't a completely benign condition. It can be a predictor for developing sustained hypertension later in life. But it requires a completely different management approach, one that focuses on lifestyle and monitoring, not necessarily immediate medication. This is precisely why home blood pressure monitoring is so critical. The final mistake. That monitor you bought 5 years ago is not set it and forget it. The sensors drift, the cuffs wear out. An uncalibrated device isn't measuring your blood pressure, it's just guessing. The solution? Once a year, take your home monitor with you to your doctor's office. Take a reading with your machine, and then have them take a reading with their, hopefully, calibrated machine. If the numbers are close, you're good. If not, it's time for a new one. So, what's the doctor's verdict on all this? It's simple: you cannot manage what you do not accurately measure. A single false reading, born from one of these simple, avoidable mistakes, can send you down a rabbit hole of anxiety, unnecessary testing, and over-treatment. You must be your own advocate. The power is in your hands, quite literally. From now on, you have the knowledge to take control of this simple, but vital, measurement. You can insist, politely, on a moment of rest. You can uncross your legs, support your arm, and ask for the right cuff size on your bare arm. This isn't about being difficult, it's about being accurate. This is your health we're talking about. Watch this video suggestion, it was especially picked for you. Also share, comment, give it a thumbs up, subscribe, and hit the bell icon. It helps a ton with the algorithm. Remain tuned for future videos to empower your health and fitness journey. So, stay healthy, stay happy, and keep going.